So this is numerous recurrent venous thromboembolisms in the setting of severe obesity and anticoagulation. This patient presented to her primary care clinic about 3 years ago to establish care and described a past medical history that included 20 deep vein thrombi, 6 pulmonary embolisms, neuropathy, and morbid obesity. At the time, she was on 5 milligrams of Eliquis for twice a day for anticoagulation, and described her first thrombotic event to have occurred in her mid-30s when she was pregnant, and this was her 3rd pregnancy. So at that time, she required multiple thrombectomies and said that her longest period without any kind of clots was following a gastric bypass procedure. And after that procedure, she had lost 200 pounds and did not have any clots for about a year. So the records at her primary care clinic show that she would go on to develop 3 witnessed thrombotic events, the first one being in 2020, which was in the left popliteal vein. The hospital records indicated she'd likely failed Eliquis due to her weight. She would have another one shortly after this in her right leg, and then another thrombotic event and a year later that was in her left leg. So there are case reports of patients with recurrent DVTs whose only risk factor was obesity. However, this patient had extensive recurrence, and that is a little bit more difficult to find in current literature. She had many workups in her lifetime, and none of them came back remarkable for any kind of coagulopathy or inherited genetic coagulative disorder. She had multiple CT scans, MRIs in her life that also did not detect any kind of cancers, along with regularly screened malignancy. So there are some theories why obesity is a cause for venous thromboembolism, but they are still undergoing research. And another potential contributing factor was the patient's history of bariatric surgery. That might have affected the way that she was absorbing some of these oral anticoagulants, who had just come out probably around the same time that she started taking them. So the patient will be undergoing a Roux-en-Y bypass in the future, and we will see if that has any improvement on her hypercoagulable state.